Members of council, delegates are ready to go. We'll call the meeting to order. Is there any disclosures of conflict of interest for items on the agenda? Seeing none. We have an engagement, Linda or Joe? Okay, Mr. Militia.
Just again, by way of introduction, the report that's going to be presented by Mr. Gill is one that is mandated through the province. They have changed some of the legislation, particularly in the Police Services Act, which requires municipalities to have a community safety and well-being plan. Here in the Essex County and Windsor have decided to partner up and have one cumulative plan for the entire region, and then have some subsequent plans within the document that will deal with each municipality. So again, that's the process we've established here. I know there was a previous deadline of the end of this year, I believe, for this, but obviously with COVID that has been extended. And I think Mr. Gill has been working through this project since late last year or early this year, I believe. So with that, I think we can just turn it over to Mr. Gill as he goes through the presentation and updating council as to where we sit with that.
Thank you very much for that introduction. I will just be sharing my screen for the slides really quickly. Okay, great. So you should be able to see my screen currently. So good evening, Mr. Mayor and members of council. Thank you very much for having me. Yes, my name is Leonardo Gill, and I am the project manager for the Regional Community Safety and Wellbeing Plan. For those who may not know me, my career has been primarily focused on asset-based community development. And actually, prior to my work on this project, I've worked alongside residents in a coordinating capacity with 2 neighborhood renewals within Windsor. I've also had the pleasure of working with the City of Windsor as the Social Investment Data and Research Analyst for Pathway to Potential and the Social Policy and Planning Department. I'm joined today by Staff Sergeant Jason Woods of the LaSalle Police Service, who is also a leadership team table member, as well as, I believe she'll be joining shortly, Miss Mary Birch, who is the Director of Council and Community Services for the County of Essex, who is a core team member and designate co-chair for the Regional CSWB Systems Leadership Table. At the end of this presentation, Staff Sergeant Woods, Ms. Birch, and I will answer any questions that you have. As per the request of the Regional CAO's table, and in an effort to ensure that all elected officials within the region have a fulsome understanding of this provincially mandated project, I'm here today to bring you all up to speed on its current status. We will be going through 3 key takeaways today. First, starting off with some background information, and then continuing on to key project updates, and finally concluding with project methodologies. To start with some background information, in the early 2000s, across the province, new approaches in policing that focused on community mobilization and crime prevention were starting to be emphasized and developed. These new approaches were born out of provincial data that indicated that while crime was trending downwards, social disorder calls were trending up. Or in other words, safety challenges were changing. Police and first responders were now responding to calls that involved symptoms of larger complex social issues, like homelessness, mental wellness, substance use, and even poverty. This changing trend really led to the creation of the following 3 booklets you see on the screen, and essentially established the rationale for the current legislation. The first booklet detailed crime trends in Ontario and presented the case for communities to start engaging in what are called upstream activities, or crime prevention and social development based approaches that focus on strengthening communities, reducing opportunities for crime, and early intervention. This booklet also emphasized the importance and impact of risk factors and protective factors. The second booklet really consisted of results of consultations with multiple sectors across the province. And these consultations really emphasized the need for greater cross-sector collaboration. And overall, it led to the creation of the Community Safety and Wellbeing Framework. And I'll discuss that in more detail in a minute. Finally, the last booklet is really a how-to planning guide on establishing these CSWB plans. While it doesn't detail all of the information, it does provide us with a good framework and a good planning process. Hello, I'm not sure if I lost you at the beginning of the presentation or not. My apologies. It must be a connection issue. 1 second. And my apologies here. If I could possibly, oh, 1 second here. Just to double check with you all, if you could please provide me a point in where it was last, where you last heard me, that would be great.
You were midway, I would guess, on page 3.
Okay, so sorry, were you looking at the context slide here?
Yes.
Okay, thank you very much for that support there. So just to recap, in terms of the first booklet here, it really detailed crime trends in Ontario and presented the case for communities to engage in upstream activities. Overall, what those upstream activities really meant is about focusing on crime prevention and social development approaches really related to strengthening communities, reducing opportunities for crime, as well as early intervention. What I was mentioning beforehand for the second booklet is really, it involved the results of consultations with multiple sectors across the province. And that allowed the province to have a better understanding of what would need to be done from a cross-sector collaboration approach, and overall led to that community safety and well-being framework that I'll be discussing. And then lastly, the final booklet is actually in relation to a how-to guide of developing these plans and really establishing the CSWB plans in earnest. So in the next approach here, considering that context, really in 2018 and really after a decade of that type of consultation, amendments were then made to modernize the Police Services Act. And in that modernization, it was trying to focus on moving away from incident response or solely incident response to more preventative and proactive practices. The amendments then led to the mandate that all municipalities prepare and adopt community safety and well-being plans. At the time, as was indicated by the CAO, the deadline established for the submission was actually January 1st, 2021. However, of course, due to the pandemic, legislation was passed to extend the submission deadline. As of today, a new deadline has yet to be established. As for the requirements of the plan, some key highlights include the need to establish a multi-sectoral advisory committee of at least 7 sectors. Those key sectors are in relation to health and mental health, education, community and social services for youth, custodial services for youth, municipalities, and police services or detachment commanders. And in our context, we actually have 9 sectors at the table, including business and public safety, comprised of fire and EMS. Another key piece, another vital element to this approach was to conduct public consultations with various diverse groups. Overall, the plan must identify priority risk factors, identify strategies to reduce said risk factors, and have outcome indicators to measure the success of established strategies. Another key piece here is that since the needs differ across the province for these municipalities, flexibility was given in the legislation as to how municipalities and regions should go about developing these plans. Some are establishing priorities for their entire region, others solely for individual municipalities, while others still are doing a hybrid approach by working together regionally to identify both local and overarching priorities. In our context and through discussions with the county, it made the most sense to undertake that hybrid approach and develop the plan in collaboration with regional municipalities and include appendices for each municipality. This, of course, was in an effort to reduce the need for duplicate advisory committees that would likely be including the same people at the table. Because as you may know, many of the organizations that would be involved in any of those sectors that I described beforehand would have a regional approach. And so it made more sense to have them at one table as opposed to 8 tables. Additionally, we could leverage the skill sets across and between the city, the county, and our police services. And ultimately, we could utilize a single consultant for engagement. So when we're talking about community safety and well-being planning, it's truly about creating an integrated approach to service delivery, one that involves multi-sector collaborations and is focused on proactively enhancing or developing evidence-based strategies. All of this is for the goal of addressing local priorities like risk factors or vulnerabilities related to crime and complex social issues. What's key here is that the approach recognizes that the feeling of community safety and well-being goes beyond the incidence of crime. In other words, there are factors that influence one's perception of whether a community is safe, regardless of whether a crime has occurred. This can be stigma, blighted buildings, and even a poverty of opportunities in a community. That said, for every risk, there is a community strength, asset, and protective factor. And these should be our starting blocks and our building blocks. So as important as it is to identify risk factors and vulnerabilities, we must also ensure that we identify and build upon the strengths and assets that exist. Currently, there are phenomenal partnerships happening in Windsor-Essex. And really leveraging these partnerships and committees is a critical success factor. We should not be building everything from the ground up, especially when we can support and grow the amazing work that is already being completed. Community members are facing challenges to their safety, health, and well-being that are complex and systemic. These challenges can intersect and be exacerbated by other social issues. So much like how these issues can cut across different sectors, so too must our partnerships and our strategies. That means everyone has a role to play, sectors and community members alike. And finally, but most importantly, these strategies must be culturally responsive. We must strive for a process that gives consideration to social and historical contexts and power imbalances, which means we must start with the intent of having meaningful dialogue with individuals and groups from diverse backgrounds. In that vein, the vision of community safety and well-being in Windsor-Essex was defined by our regional systems leadership table as a community where everyone feels safe, has a sense of belonging, equitable access to services and opportunities, and can have their needs met across Windsor and Essex County. You will notice included in that definition are elements of the CSWB framework. And jumping into that framework, really, the framework identifies 4 key areas of intervention. We can intervene through social development at the top layer, prevention, risk intervention, and incident response. But let's start with incident response, because commonly, when we think of safety interventions, we tend to focus primarily on the center of that bullseye at the incident itself. We tend to approach it from a policing, fire, or emergency services perspective. But as I was mentioning earlier, research is showing that more and more often, police and emergency services are responding to situations related to well-being that are symptoms of larger issues, whether it be a mental health crisis, substance use challenge, or housing insecurity. And despite how well-trained our first responders are across the region, and they are well-trained, these are issues that they can't solve alone. Considering that, let's move up to the next layer at risk intervention. So the yellow layer there. This layer focuses on reducing harm before it becomes a critical or non-critical incident. These are situations of what are called acutely elevated risks, or situations where if action does not happen, it will likely lead to harm to self or to others. This is the type of work that is being completed by groups like situation tables across the province and within Windsor-Essex, and usually involves partnerships between city departments, healthcare, public safety, and community partners. The next layer, prevention, is about proactively identifying and addressing local risks before they escalate. Prevention necessitates the involvement of all people, really regardless of their expertise. To think of this in another way, people in a neighborhood or community will be first to notice when a change, positive or negative, has occurred in the area. Because they're in tune with their environments, especially their daily environments, and they're therefore a great resource to finding protective factors and assets to meet that change. Finally, at the top layer is social development. And usually this will involve longer-term investments or strategies to improve what are called the social determinants of health and well-being, or the underlying conditions that are shaping daily life. These are, for example, access to income, education, job security, and quality housing, to name a few. Work in this layer involves us looking beyond the incident at the social causes and really understanding that those causes need integrated and collective responses. So to pull these concepts together, if instead of starting at the incident as the primary area of intervention, we start at the social development layer, then we can work to build on protective factors and strengths, emphasize prevention and risk mitigation strategies through the use of data and evidence-based practice, and ultimately work to reduce our incidents by intervening before challenges become crises. So for your reference, I have included my talking points for each of these areas on slides 9 through 12, but because I've discussed each section, I will continue on to slide 13. So overall, to conclude this section, these plans recognize that there are existing strengths in leadership within our communities and across multiple sectors that can be leveraged and engaged to proactively address local priorities related to crime and complex social issues. This is not about reinventing the wheel. And by promoting upstream activities and focusing on social development, prevention, and risk intervention, the framework really works to stop challenges from turning into crises. Incident response is, of course, a vital piece of the puzzle. But once again, the goal of these particular plans is to be proactive and to be preventative. Ultimately, the nature of this approach, from its inclusion of diverse voices to the identification of priority risks and strengths, means that these plans should be seen as living documents, ones that can be built over time and have that built-in flexibility and adaptability for issues that may come along down the road. Considering these points, our plans, while developed regionally, will include appendices and data profiles for each municipality. The intent here is to ensure that local priorities in each municipality are identified. So moving from there, now that we have that better background of the CSWB planning, we'll jump into the second takeaway, which is the current project updates. As you may recall, in our last council report to City and County Council, we provided updates related to the project pause due to COVID-19. In brief, here are some update or highlights of that report. Really that staff were redeployed between the months of March and June. Letters to AMO and OMSA were written advocating for an extension to the January 1st, 2022 deadline. And all project team meetings were put on a pause as really our community partners and ourselves were being taxed with extra and increased workloads and responsibilities. We wanted to pay respect to the fact that our community partners were at a high level of need to be focusing on this pandemic, as rightfully so. And so we wanted to make sure that we weren't overburdening them with work that just wouldn't be feasible for them to be completing in those intervening months. But since that July council report, we have some great updates. I mean, consulting firm Strategy Corp was successfully awarded the contract through an RFP process, and they will be supporting us through the engagement process that I'll be discussing shortly. And we also were able to re-engage our project teams. And in this case, I really want to just add here that we've had some great partners and champions with the LaSalle Police Service and our point person, really, Staff Sergeant Jason Woods and his team members, Sergeant Terry Seguin and Staff Sergeant Duncan Davies. They have been absolutely vital members to the leadership table and the data team, and have helped not only with the collection of local data, but also the contextualization of that local data, which is incredibly important for this project. So just wanted to make sure that I gave those appropriate kudos. Another thing is that we actually were able to re-engage our AMO and OMSA representatives and working groups. And this is a particular note because quite frankly, that working group allowed us to connect with other municipalities in the province who are also completing these types of CSWB plans. And so through that ability to connect with them, after discussions with these municipalities, three things became very clear. The first is that we're in a very strong position, as we did not go to public consultation as originally planned in April and May. What's key to that is early consultations would not have allowed us to ask questions about the impact of the pandemic on individual and community priorities. And so now that we are looking at a February date to start that online survey and those virtual town halls, which I'll be discussing, we now have an ability to ask residents about factors before and after the start of the pandemic that are important to them in terms of that priority. Also, second, our requested extension was in line with other municipalities. Consensus was established amongst the municipalities that a deadline of December 31st, 2021 would be most appropriate for most municipalities. And so quite frankly, we were a day off in terms of our estimate there. Additionally, AMO and OMSA representatives will be advocating for a December 31st, 2021 deadline as well. And lastly, in regards to this, our current status is on par with most municipalities. So again, very important to have that connection with OMSA. In regards to our current status as well, there are two key deliverables that I'd like to introduce to you all. The first is our risk factor data categories, and the second being asset mapping. So with the help of our data team, which is really comprised of data analysts and data stewards from our leadership table member organizations, we were able to synthesize identified risk and protective factor categories into the 7 categories that you see listed before you. And from there, our consultants went through publicly available databases to identify indicators relevant to those categories. And as they did that, we were able to consult with the data team through a number of methods, whether it be through an online survey that we had for them, either in-person consultation or a group consultation or group discussion. And in doing so, we were able to validate and finalize indicators for each category. What's very important here as well is that we were looking at both quantitative and qualitative data. And we were collecting that from both a regional and a municipal level of analysis. And so why that's really important here is that having that qualitative and quantitative connection, we get a chance to contextualize what some of those more quantitative or number-based data points are indicating. And we're able to then have that contextualization to have a better idea of what that data truly means with respect to our region and with respect to our local municipalities. And this information really has formed the basis of our current state analysis and will inform the development of our online survey. And lastly, overall, this data, both quantitative and qualitative, will support the leadership table and our enhanced sector network, which I'll be discussing shortly, in identifying and also contextualizing those local issues even more. So it does give us a good, well-rounded idea of what's occurring in our communities across each of those 7 sectors. And you'll also, those 7 data categories. You'll also notice, for instance, for the data category number 6, housing and neighborhoods, as well as COVID-19 impact number 7, that there's 2 subcategories for that. And really through the discussions that we've had with our data team, we were able to identify that there were some subdivisions that we needed to really look at under those overarching risk and protective categories. So for instance, when we're talking about things like COVID-19, of course we could be collecting information on health, but we also want to be collecting information on the economic impact for our region. Much like for housing and neighborhoods, it's important for us to be understanding some of the environmental impacts that may be happening with changes to issues related to flooding or issues related to heat or weather advisory days. The next kind of key update here, the key deliverable, is asset mapping. And really, since the project is focusing on leveraging existing strengths and strategies, this type of asset mapping is really an important deliverable. In our context, an existing body inventory has really helped shape the development of the leadership table as well as our enhanced sector network. A strategy inventory has helped us in the development of our current state analysis report, and overall our asset mapping or asset map will help us ensure that existing community strengths and assets across the region are considered when developing recommendations. And I have to say, while it is in a pictorial form here, the interactive map is fantastic and one of my favorite parts of this project so far. We've been able to connect and partner with the City of Windsor's Geomatics Department, but in addition to that, really connect with the County of Essex Geomatics Department and 211. So consulting with both of those departments to collect assets and lists of assets that essentially have been established prior to, but also to add to that information. And really, actually, as of Friday afternoon, that number of 900 assets has actually grown to 1,240 assets through the support of our leadership table. They were able to review the assets that we had and add to it accordingly. So to give a bit of a sneak peek, again, although it's not in its interactive form, we can isolate municipalities, and we can even zoom into certain areas in each municipality. And so what you'll see before you is, again, a pictorial form of the town of LaSalle. And in here, we actually have 52 assets that have been identified specifically in LaSalle. So while if you're adding that up really quickly, you might add 41. But since our additional assets were included, we've added 10 community services and 1 employer service, the LaSalle Business Association, to that list. And so please note that from the beginning of this approach, we've really had the intent of making this interactive map publicly available once it's been fully finalized. It's not quite there just yet, but this is definitely what we are going to be pushing for. You'll see on the right-hand side as well of the screen, you'll have a legend, and that legend actually includes many of the subcategories that we're using for underneath these additional larger or main categories. And of course, because we've increased the scope based off of the increased number of assets, we also have a few more data categories under there, subcategories under there, including places of worship and Francophone community services and organizations. So for the third takeaway, we'll dive a bit deeper into our project methodologies. Clearly, COVID-19 has made a vast impact on normal methods of public engagement. And in consideration of the pandemic and current restrictions, we've opted to move towards a more fully online engagement process. And to try to mediate barriers to participation, we are including dial-in options as well as CSWB toolkits or paper copies of the survey. Our engagement approach has 5 main pillars. The first pillar is actually what we're doing today, which is the municipal council presentations, because we wanted to ensure that all elected officials within the region were familiar and informed of the planning efforts and the approach that we are taking. The second is the enhanced sector network, which I'll be discussing shortly. The third and fourth are actually parts of our public consultation approach. The third being that online and print public surveys, fourth being the virtual town halls. Those virtual town halls, we wanted to make sure that we had 1 session per municipality. And in this case, we're going to do that and have 2 sessions for the city of Windsor, simply because of the population size. We wanted to make sure that we could collect that information in those sessions appropriately. And then lastly, and as it relates to you all, we will be conducting virtual focus groups with CAOs and elected officials for each municipality. You'll notice the timing of the focus groups occur after the public consultation process. And that's really being done to ensure that the data analysis is completed on that public consultation effort before reconnecting with you all. We really felt that in doing it this way, you all will be able to discuss a review of the latest information and the latest data that was collected through that public consultation process. With respect to the enhanced sector network, the purpose here, the purpose of the approach is really to ensure that diverse voices from historically underrepresented communities were heard and their priorities were woven throughout the planning process. And we truly feel that this will best inform not only the CSWB planning process, but also the leadership table by contextualizing community data from multiple population lenses. For clarity, the ESN will consist of 8 network groups as listed on the screen. Each group will be comprised of representatives from existing committees and community organizations. Overall, what we'll be asking them to do is really participate in 2 meetings over the course of the project. The first will involve qualitative activities and a review of the current state analysis. And then the second will involve a prioritization process based on the results of public consultation. So to recap some of those engagement approaches, and starting with the lower half of the image, you'll notice that the community engagement is subdivided by general and stratified. The general approaches include that public consultation and online print surveys, as well as the virtual town halls. And as you'll notice here, the consultation results will inform the stratified approach with respect to our CAO and elected official focus groups. You'll notice that there's the enhanced sector networks there as well, under stratified. And just to kind of inform you a little bit about this as well is just that the reason why we have these different sections is that there are times when we're looking at public consultation that there's something called self-selection bias. And so individuals who may be more likely to attend a public consultation or more likely to provide their input through an online survey may be easier to connect with. And it's not a bad thing. That's great that they're informed, that they want to be participating. But what we want to make sure that we do is through our enhanced sector networks, really try to get the word out about when some of these virtual town halls are happening, when the online survey is available, and making sure that groups from those diverse backgrounds may have access to some of that information, or reduce that, at least that barrier of understanding whether or not that would be, that it's occurring in general, right? And so this is a way for us to try to do that. Something as well to indicate here is under that enhanced sector network, we would love to have as many people at the table for those discussions, to have them review the information and provide their prioritization. But something that's just truly, it's just the reality is that we can only have so many people. One way that we can bypass that is actually through what we're doing now, which is called a notification list, or enhanced sector network notification list. And we will be, we've been connecting with our leadership table. We will be connecting with all the municipalities to request other organizations to be included in that enhanced sector network notification list. So this way, again, while they may not be available, or able to attend those particular meetings, in this case, they'll be informed of the online surveys as well as the virtual town halls and when they're occurring. So we can try to have as many people provide their input as possible. Then you'll notice on the second part, the project team is actually just a breakdown of who all is involved in this process. And you'll notice there are several interactions across the board with respect to those dual arrows that you may see. You'll also see some single lines, and that really is representing responsibility. So the consultants will be responsible for not only the elected official focus groups, they'll also be responsible for the public consultations. So they will be conducting the virtual town halls in the county, and they will be also supporting us with developing that online and print survey. Whereas I myself, as project manager, am part of the internal core team, and clearly I'll be responsible for these presentations as well as involving the enhanced sector network and connecting with the enhanced sector network. So finally, overall, when we're looking at our estimated project timeframe, it is about 16 months. When developing that project timeline, we factored in the presumed extended deadline of December 31st, 2021, as well as the impacts of both COVID-19 and really the need for greater diversity and inclusion in the planning process. Ultimately, we expect to begin our public consultation period in February 2021 and have established a bit of an extended public consultation period, so it is about 6 weeks, so that we can have as much input as possible. In addition to that, we are looking to be submitting the report to city and county councils between the months of September and November. So with that, thank you very much for your time. Again, we're here for any questions that you may have.
Thank you, thank you, Mr. Gill. Ms. Birch, is there anything you want to add?
No, I think Leo's covered it all. Maybe one thing to add is that we do plan on having an extensive communications campaign as well, so that we're sure to reach everyone in the community.
Thank you, Mary. Any questions? Seeing none, Mr. Gill, thank you for your presentation. Thank you to Staff Sergeant Wood, Staff Sergeant Davies, and our CCAO, Mr. Seagang, for your help in setting this up. So we do have a motion, I'll read it, that the presentation of Leonardo Gill, Project Manager for the City of Windsor, regarding the Windsor-Essex Regional Community Safety and Wellbeing Plan be received. Moved by Deputy Mayor Malash, seconded by Councillor Akpata. All in favor? That carries. Thank you very much, everyone. Have a good evening, and we'll see council at 6 o'clock. Take care.
Thank you, Mr. Mayor. Bye now.